Students, now in this lecture, we are going to study about the routes of drug administration. Now, routes of drug administration is a very important part of general pharma. We need to understand how the drug is administered. So, a drug can be given by a variety of routes. They are called as local or systemic. The choice of a route depends on many factors. We'll see them one by one. So, what are the various routes that we are going to study in this? Now, routes can be local or systemic. Local, you understand that it is at that particular location or place, while systemic route is something in which when the drug is given, it reaches the whole body or the system. So in local routes, then we have skin, buccal, eye, ENT, rectal, vaginal, urethral. So these are topical routes also. Then in deep, we have intra-articular, retrobulbar, intrathecal, intrapleural, intraperitoneal, intraarterial. These are again local routes, but they are deep situated. They are not on the skin or on the mucosa. Then systemic routes include oral, sublingual and rectal route. Parenteral route includes IV, IM, subcutaneous and intradermal, that is intravenous, intramuscular, subcutaneous and intradermal. And other routes include inhalational, nasal, transdermal and transmucosal. Now this transdermal and transmucosal routes we have covered in the drug delivery systems. And here the rectal route comes in local as well as systemic, because sometimes some drugs we just want them to act rectally or at the anus level, so they are given rectally. Some drugs are given in the rectal route mainly for systemic action, then it becomes a systemic route. Similarly, subcutaneous also is a route which comes in deep as well as systemic, because sometimes certain drugs they are given only for subcutaneous exposure or subcutaneous action, and sometimes they are given for systemic absorption and systemic action. So these are the various routes that are important and through which the drug is distributed. You should remember all the routes, and this sometimes comes as a long question, so you should be able to write in detail about all the things. Let's go through them one by one. Now the next thing that we would like to study is what are the factors which govern the choice of route. The first thing is the drug characteristics. That is the first thing. Obviously, if a drug is liquid, then it can be taken orally or it can be taken by IV route. So whether it is solid or liquid or gas, then what is the solubility, whether it is lipid soluble or lipid insoluble, what is the stability, is it stable at room temperature, what is the pH, what is the irritancy level, is it toxic. So all these factors, drug characteristics, play a very important role. The second thing is the site of desired action. So where do you want the action? So do you want a local action? Then we will go through a local route. Or do you want a general action in the body? Then we'll go through a generalized route, right? Third thing is the rate and extent of absorption of the drug. So if a drug is better absorbed from the sublingual route, then we'll give it by sublingual. If it is better absorbed by intramuscular, then it is given by intramuscular route. So whichever route the drug is best absorbed from, it is administered from that place. Then what is the effect of digestive juices and first pass metabolism, right? So what is the effect of digestive juices and first pass metabolism on the drug? If it is taken by oral route, what are going to be the factors which affect its absorption? Then what is the desired rate of onset of action? When do you want, like, is it a routine case or is it an emergency? So if it is an emergency, we will use IV route. If it is a routine, we can always give it by oral route. So the desired rate of onset of action is also important. Next point is accuracy of dosage required. So IV or inhalational routes can provide the fine tuning in the doses. So accuracy, if you want a really accurate dose to reach the system, then give it by IV route. It will be completely absorbed and will be 100% available. And then very important thing is conscious, vomiting, cooperative. So what do I mean here? Here I mean what is the condition of the पेशेंट. सो पेशेंट कंडीशन क्या है? पेशेंट कोऑपरेटिव है क्या, वॉमिटिंग कर रहा है तो आप ओरल नहीं दे सकते हो. अगर कॉन्शियस है तो ही ओरल दे सकते हो. अगर अनकॉन्शियस है देन यू हैव टू गिव बाय पेरेंट्रल रूट. यू कैन नॉट गिव इट ओरली. सो दीज आर द फैक्टर्स विच गवर्न द चॉइस ऑफ रूट. ओके, सो नाउ लेट्स सी द टॉपिकल रूट्स. Okay, now in topical routes, as we have seen that it is mainly skin or buccal mucosa or eye, ENT, the rectal, vaginal. So basically it is external application. Topical route से हमारा मतलब है external application of the drug to the surface for local action. We want the action at that place only, right? So that is a topical route, and drugs are effectively delivered at that place. It can be the dosage forms can be lotion, it can be ointment, it can be cream, it can be a powder or rinse like mouthwashes, or it can be a paint or drops or sprays, and even lozenges that you use in case of sore throat. It is acting locally. Then rectally we use suppositories, right? And vaginally we use pessaries. So these are also dosage forms which can be used topically. Then another very important, I would like to tell you that some antibiotics, like some non-absorbable drugs given orally for their action on GIT. And what are they? There is a drug which is given orally in hepatic coma cases. So this is neomycin. Then we give another drug which is sulfasalazine, which is used in ulcerative colitis, and it has a we use sulfasalazine which is used in ulcerative colitis, and it has a local action, right? Then other drugs also we have like sucralfate. It acts on gastric mucosa. Then so these are the local routes. Now topical mein we go to the deeper routes. Now deeper routes usually are basically, again, deep areas are penetrated or approached with a syringe and needle, and needle से हम उधर injection लगाते हैं. But it is important that the systemic absorption is slow or none. So the drug is basically acting in the local area. For example, we give intra-articular injection in case of knee joint, some inflammation. So knee joint mein we give hydrocortisone, which is a steroid. Hydrocortisone intra-articular injection is given in injuries to the knee joint. Then we can give retrobulbar injection is given. Again, hydrocortisone is given behind the eyeball. Then close intra-articular injections can be given. For example, contrast media is injected in the artery in case of angiography. So that is a local route. The drug is not getting absorbed in the system. Then sometimes anti-cancer drugs are injected in the femoral artery or brachial artery to localize the effect on limb malignancies. So these all are local routes, right? So just a recap: local routes, topical, it consists of external application of drugs in the form of various dosage forms. Then some non-absorbable drugs can be given on GIT also, local action. Then deeper routes may we give the drug by syringe and needle, but it has a very local action like intra-articular, retrobulbar or closed intra-articular injections in case of contrast medias and anti-cancer drugs to localize the malignancies. Now coming to the systemic routes. In systemic routes, the first route that we discuss is oral. Now oral route is the oldest and the commonest route by which the drugs are given. It is safe, it is convenient, self-administration is possible. Patient can take the medicines by themselves. It is non-invasive. We do not need to put any kind of syringe or needle. It is painless. There is no pain. The medicine need not be sterile, right? And so it is cheap also. Through this route, we can give solid dosage forms, we can give liquid dosage forms, right? So solid dosage form, we have tablets, capsules, powders, GITs, and liquid dosage form like syrup, suspension, emulsions, mixtures. Now, so these were the advantages. Now coming to the disadvantages. So what are the disadvantages of this route? So disadvantages are action of the drug is slow, so it cannot be used in emergency. So if the patient comes with emergency condition, then oral route is not the right route, then cannot be used in uncooperative. If the patient is uncooperative or if the patient is unconscious होगा तो कैसे देंगे हम, है ना? Or if the patient is vomiting, then he will just take it out. And even in children it is very difficult sometimes, so we have to give them drops. Then unpalatable drugs, which are unpalatable means drugs which are very bitter, then they are difficult to administer, so they are usually given by IV route or IM route, the drugs which cannot be taken orally. Then fourth is that this route may cause nausea and vomiting. The most common side effect of drugs taken by oral route is nausea and vomiting. Then absorption of the drug may be variable. And why it will be variable? Because there is first pass metabolism through which the drugs go, and sometimes 80% or 90% of the drug is removed in first pass metabolism. So the drug which actually reaches the system is very less. Then some drugs do not get absorbed only. So presence of food, presence of milk, presence of other drugs, that affects the absorption from the GIT, right? So food interactions are there, drug interactions are there, acid in the stomach, all these factors sometimes reduce the absorption, oral absorption of the drug. Then as I said, first pass metabolism is very high and it usually makes the drug very less available. Then chances of all these interactions, so a lot of interactions can interfere with the absorption of the drug. So this was about oral route. The next route that we have is the buccal route or the sublingual route. So sublingual route, as we discussed in the dosage forms and the drug delivery system also, that the drug is kept below the tongue. Below the tongue it is kept, or it is kept on the buccal mucosa as a patch. So this, it can be spread in the buccal, crushed in the mouth and spread over the buccal mucosa. So in this only we can give lipid soluble drugs and palatable or non-irritating drugs. Non-irritating drugs can be given by this route, and the good thing here is that absorption is very rapid, because through this route we bypass the first pass metabolism. So we bypass the first pass metabolism and then the action is produced in minutes. Then you can always stop the action, you can always terminate the action by removing or spitting, by removing the drug or spitting it. So there is no issue that it cannot be stopped. Then this can be self-administered also. So this is the drug, this is a very good buccal mucosa wala jo route hai, bahut acha route hai, and it has got a lot of advantages also. Then we have the third route, which is rectal. Now rectal route is basically topical also. Sometimes the drugs, they need to be administered to be acting in the rectum, and it can be systemic also. So systemic route का जैसे example होता है paracetamol is given in children by rectal route when they have a very high fever and when they have febrile convulsions especially. So because rectal route is very fast, again why it is fast, because it also bypasses the first pass metabolism. So rectal route also goes directly into the systemic route. Then so this again, and this route can be used in a patient who is having vomiting, recurrent vomiting on taking oral drug, and or if a patient is unconscious, right? The only disadvantage of this route is that it is embarrassing sometimes, and thoda sa it is inconvenient for the patient. Okay, so that is one thing. Then the next route that we have is inhalation route. Inhalation route ke through we give general anesthetics. They are given to the patients when we go for operations, right? Then another thing is that we can give them all the drugs which are effective in asthma and COPD, which are given by meter dose inhalers and rotahalers. So this is rotahalers. So this is inhalation route is used for that. Advantages is that the absorption is very rapid, and so the action is very fast. Onset of action is fast, right? Then after that we have another route, which is nasal. Now nasal route, basically the mucous membrane of the nose can absorb many drugs, and again the first pass metabolism or the liver is bypassed in the nasal route also. So that is again a benefit here, but only some drugs like GnRH agonist are given through this route, calcitonin. Then there is one more drug, that is desmopressin nasal spray. It is used as a spray or nebulized solution through this route, right? Then coming to the parenteral routes. So in the parenteral routes, we have subcutaneous, we have intramuscular, we have intravenous, and we have intradermal. So let us see the subcutaneous route first. Now, conventionally, parenteral means when the drug is given by the injection. So the drug is directly taken into the bloodstream without going into the intestines. And coming to the subcutaneous route. So in subcutaneous, the drug is injected in the loose subcute tissue, right? Now, इसकी एक खासियत होती है that it is having more nerves and it is less vascular. So here, because of this, irritant drugs cannot be given, right? Less vascular, so absorption is slower than the other routes like intramuscular. Then another thing is only small volume can be given. We cannot give a huge volume. So that is one thing. And secondly, it can be self-administered. So because not very deep injection is needed. It can be self-administered because no deep penetration is required as compared to intramuscular. Then it is contraindicated in shock conditions where already the patient is vasoconstricted. So even if you give a drug by subcutaneous route, it will not be absorbed. So here, then another thing, we have some depot preparations. Sometimes they are given depot preparations, which are basically aqueous suspensions. They can be given as a drug for prolonged injection. A very useful new drug is there, which is called as Dermojet. Now, what are Dermojet? Dermojet are basically no needle. Basically, they have very microfine, high velocity jet, which basically projects the drug solution on the skin using a gun. So it gets absorbed and ultimately produces the effect, and it is usually used for mass inoculations, no? And it is completely painless. So this is one route, a variation of subcutaneous route. Coming to the next route, I'll take it here, that is intradermal. So intradermal route is not very commonly used. The one place where you must have heard of intradermal route is testing of tuberculin antigen, that is called as MAN2 test, right? And also BCG injection, it is given intradermal, so it raises a bleb and then it results in scarring. This is basically used for specific purpose. So intradermal route is not very commonly used. Subcutaneous route is used in many conditions. Most commonly, if you say insulin is given by subcutaneous route only to the patients of diabetes mellitus. Next, let's see the intramuscular and intravenous route. So intramuscular route पे सबसे पहले आते हैं intramuscular route. Now intramuscular route में remember that intramuscular route has got more vascularity and less nerves. So increased absorption. If you give a drug by intramuscular route, it will be absorbed faster, and mild irritant drugs can also be given. It is less painful, but self-administration is not possible. Why it is not possible? Because here you have to go deep, because deep penetration is required in the muscle is required. Now, what are the areas where intramuscular injections can be given? It can be given in the deltoid, in the arm. It can be given in the gluteus maximus. It can be given in rectus femoris. It can also be given in triceps, right? So here we can also give depot preparations can be given, and you can even give oily. So in oily we have some hormones which can be given. They can be given as depot preparations. Then intramuscular injections to be avoided in patients who are taking anticoagulants. Why? Because otherwise there will be bleeding and that can result in formation of hematoma. So it has to be avoided in patients who are taking anticoagulants, right? So this is about the intramuscular injections. Coming to the intravenous route. So intravenous. Now intravenous route is basically directly you are giving or injecting in the bloodstream, right? So we usually use a superficial vein for it, and superficial vein में हम IV line लगा के we inject the drug, and this can be done as a single dose bolus or as an infusion. Infusion means a continuous drip is there. Then this produces the effect immediately, right? Now irritant drugs can be given. Irritant drugs can be given, but you have to take care, and so dilutions are always better. It is always better to dilute the drug and then inject, so that it can any further effect can be avoided. Then it is the most risky route. Why it is risky? Because you are directly exposing the heart, the brain, the kidney. These are the vital organs. You are exposing them to high concentrations of the drug. So it is a risky route also. The side effects are also more. Then another side effect that can happen is air embolism. That is something that can happen, and only aqueous solutions can be given. Suspensions cannot be given because they can result in embolism. Suspensions not given as they cause embolism, right? So this is the intravenous route. This is the route that can be used in emergency condition, very fast action. Bioavailability is 100%. You will study about this fundamental in pharmacokinetics, and it can be used. Infusions are given of certain drugs to maintain CPSS, that is steady state plasma concentration. So these are the different parenteral routes. Now, what are the advantages? Advantages of parenteral. What are the advantages of parenteral route? So the first advantage is that it has got a faster onset of action. While in oral route it was slower onset. It is useful in emergencies. While oral route we couldn't use them in emergencies. It can be used in uncooperative or unconscious or vomiting patients, right? Uncooperative, unconscious and vomiting patients, it can be used. Then you avoid the first pass metabolism, right? Then no effect of food or acid which is there in the stomach. Then we can give unpalatable or irritant drugs also by this route, right? Then what are the disadvantages? Disadvantages क्या होते हैं? That first of all, the drug needs to be sterile. You cannot give a non-sterile drug, otherwise it will result in infection. Then full aseptic procedures need to be applied. You just can't apply an injection on anyone. Then so cost of sterilization and injection and उसके जो पूरे तामझाम है, syringe, needle, IV drip, वो सब होता है. Then it is definitely invasive and painful. It requires a trained person. You cannot give an injection without training, so trained person is required. And then it can cause local irritation or thrombophlebitis or tissue injury. So these are the various side effects which are seen with local with the intravenous. Intravenous के साथ भी the major side effect usually very commonly seen is thrombophlebitis. So this is usually seen with the parenteral routes. One last thing that I would like to tell you about the angles of various parenteral routes. What are the angles of syringes? This is something that you should really know. Like if this is the skin surface, so this is intramuscular route which is given at 90 degree. Okay, intramuscular route is given at 90 degree. Then subcutaneous route is given at 45 degree. Okay, then intravenous route is given at 25 degrees and intradermal is given at 10 to 15 degrees. So this is the angle of the needle that you need to keep when you are injecting. When you inject intramuscular, keep it straight. Subcutaneous, make a 45-degree tilt. Intravenous, you have to take a 25-degree tilt, and intradermal is just 10 to 15-degree tilt. Okay, so with this we finish the route of administration. Now we'll be starting with the pharmacokinetics. Okay.